Hi, my name is Shmuley Schwartz. I work at Revival Home Healthcare. My grandfather, Rabbi Yaakov Lev Spitzer, founded this company in 1989 to meet the needs of the Jewish community. Revival Home Healthcare is proud to sponsor the safety video you are about to see. Revival is sponsoring this video because we care about the health and well-being of the Jewish community. We have been providing nurses, therapists, home health aides, and social workers to Jewish patients for over 10 years. At Revival, we know what makes a Jewish patient feel comfortable. Revival understands the kosher home, the restrictions of Shabbos, and the minhagim of Jewish family life. If you or anyone you know needs care at home, call Revival. Revival accepts Medicaid, Medicare, and private pay insurers. Call Revival at 718-629-1000. Remember, it's your health, your home, your choice. Revival is the right choice for Jewish patients who need care at home.
Cribs. They're supposed to keep your children safe when they sleep. But recently there was a recall of more than 1 million Chinese-made simplicity cribs after 3 infants died in them. The children suffocated when the drop side became loose and the infants became stuck between it and the mattress. In fact, more children die every year in accidents involving cribs than any other nursery product. If you're buying a new crib, be sure that corner posts do not extend more than 1/16 of an inch above the top of an end panel. Corner posts can be catch points for items worn around the child's neck or clothing, such as a hood. There should be no more than 2 fingers width between crib side and mattress. Bumper pads should fit around the entire crib and tied firmly in place. Use bumpers until a child can pull himself up to a standing position. Thereafter, remove bumpers so that the child does not use them to try and climb out of the crib. Make sure that slats are spaced no more than 2 3/8 inches apart to prevent child from getting a limb caught. And perhaps most importantly, make sure that drop side latches securely hold crib sides in raised position. Make sure hangers are secured by proper crib hardware, which throughout the existence of the crib should be checked frequently. And check to see that mattresses fit snugly. As for crib toys, avoid those that stretch across the crib, which have resulted in cases of entanglement and even strangulation. Also, mobiles and other hanging toys should be kept out of the reach of children. When positioning the crib, never place it near drapes or window blinds, since children have strangled on window cords. If you are having trouble putting your child to sleep, never ever place your infant on an adult bed. Children up to the age of 18 months can suffocate in their sleep due to rolling when the child's body or face becomes wedged between the mattress and the wall. Similarly, playpens have caused death and injury when the mesh drop sides were left in the down position. When left down, the mesh hangs loosely, forming a pocket between the floor and the side. Tragedy has also occurred when the top rails collapse, forming an acute V-shape that entrapped the child's neck. Water presents a real problem. Never, even for a moment, leave your child alone in the bathtub. Bath rings or seats are intended for use as bath aids. They are not safety devices. Turning away to get a towel or answer the phone could result in a baby drowning. Only fill the tub with enough water to cover the child's legs. Be aware that babies can drown in very small amount of water. Children can and will get into everything. Therefore, make sure the toilet seat is secured. Baby gates are used to prevent toddlers from falling or entering unsafe areas. But some baby gates themselves are dangerous. Entrapment and strangulation hazards exist with accordion-style gates that have large V-shaped openings along the top edge and diamond-shaped openings between the slats. And of course, be sure that the baby gate is securely attached to the doorway or staircase it is blocking. Children have known to push gates over and fall down the stairs. Each year, thousands of children are treated for injuries associated with high chairs. The majority of these mishaps result from falls when restraining straps are not used and when children are not properly supervised. Therefore, to prevent accidents, high chairs should have a waist strap and a strap that runs between the child's legs, both of which should always be used. It is also of the utmost importance to keep the high chair far enough away from a table, counter, or wall so as to prevent children using these surfaces to push off and topple over. Hook-on chairs and/or children's seats are often used as substitutes for high chairs. Make sure they are properly secured to tables or dining chairs. Since 1997, an industry standard for baby walkers has included performance requirements that prevent walkers from falling down stairs. The complying baby walkers have groper strips on the bottom to stop the walker at the edge of the stairs. The newer baby walkers have helped achieve dramatic reductions in injuries. Most accidents pertaining to changing tables are the result of children falling off the table. This can be avoided by using safety straps or by the parent or caregiver positioning their body as a defense barrier. Make sure changing tables has drawers or shelves for diapers and clothing that are easily accessible. Time to get out and get some air? Stretch your feet and hope maybe your child will fall asleep. Remember to check that the seatbelt fits snugly around your child. Too often, in their sleep, infants have wiggled through the opening between the handrest and front edge of the seat. Their heads became trapped, causing strangulation. Beware of tipping stroller over with shopping bags and hanging pocketbooks. And when folding the stroller, keep your child away. Children's fingers have been amputated and parts of the folding mechanism. You should know that most injuries associated with carrier seats are the result of falls. The movements of an active child can cause the carrier seat to tip over. Remember to secure the child within the seat by securing him with the seatbelt. Make sure to buy the right car seat. Once again, make sure your child is safely strapped into the car seat, which should be securely fastened using the car seat belt. And yes, while you're driving, please drive carefully. Toy chests have often been handed down from generation to generation. The Tourist Safety Commission has received reports of death and brain damage when toy chest lids come crashing down on children's necks or heads. When buying a new toy chest, make sure it has support that will hold the hinge lid open. Also check to see that chest has been designed with an opening between the lid and sides so that the child does not close the lid on his fingers. The intention of this presentation on infant product safety has been to increase the awareness of parents and caregivers about potential hazards in the child's environment. In addition, the Tourist Safety Commission strongly advises parents to exercise caution in selecting and maintaining these many children products. Do your homework. Research products by consulting the Consumer Product Safety Commission or publications such as Consumer Reports, or contact the Tourist Safety Commission.